Good evening, everybody. I just wanted to check in this evening, talk a little bit about what we've been up to here at the State Operations Center, what we've been working on throughout the state of California, both at the ground, in communities large and small all across the state, and give you a little bit of preview of where we think things are going over the next hours, not just days, and over the course of the next few weeks. There were a series of technical actions the state of California took today to codify an announcement I made last night, specifically to the issue of school testing. As a father of 4 young children, as a member of a system of public education in the state of California that those children that are no longer in school. We put out directives yesterday on distance learning, on curricula to help support homeschooling in the state of California. We expect that we'll continue to educate our kids, but obviously with these school closures and the expectation, as I honestly assessed last night, that the school year itself likely will end through the summer school session, that we want to give people assurance that we have the kind of comprehensive set of materials that we have now made available online throughout the districts, those that have closed, the few that remain open, but also available to the public more broadly. But we also wanted to put to rest the issue of testing. If your school potentially does come back, you're not going to be tested. These kids don't deserve to be tested with all the anxiety, the social emotional stress associated with these schools shutting down, the last thing we should consider. So that was codified today more formally through an executive order. We also did another series of executive orders, some maybe more meaningful than others, on issues for technical issues for businesses, something called the WARN Act, which means you just have to provide notification for mass layoffs. We reduced the restrictions related to that. Interstate commerce to allow logistics to move between states. We also clarified some of those rules and rulemaking and basically aligned them with the federal rules. We did the same on issues that are a little bit more personal to people, and that's the issue of the social safety net in the state of California, issues related to access to CalWORKs and food stamps, welfare to work, and making sure that people don't have to come up for eligibility with the kind of anxiety that this moment meets. We're basically allaying those concerns, at least for the next 90 days, likely to extend beyond that to make access and availability of those benefits more readily secured. So people that are existing recipients of those benefits don't have to worry about coming back for reauthorization. We really want to focus on new beneficiaries, people that are applying in real time. That will be our focus. So that was a significant executive order that we advanced today as well. A technical one, but important to many people. As it relates to public meetings, we clarified some ambiguities on Bagley-Keene. You can ask me about that later. A more complicated subject, but it goes to the issue of open public discourse, goes to the issues of transparency, which is important to all of us. So we clarified that as well. On the substantive side, in terms of a thrust of real focus for the state, it's the issue of homelessness. We also put out an executive order related to this issue. We have prioritized this issue in the state of California. We doubled down one of the historic investment last year, $650 million of emergency grants to address the needs of our most vulnerable residents in the state of California. Some 108,000 unsheltered homeless in the state, 151,000 in our last point in time account. We're modeling our concerns and we are planning, but now we're distributing real resources and real funding. In addition to the money that was made available last year in the emergency grants, we wanted to provide more flexibility for the cities and counties on how they access those dollars, and more certainty that when they draw down those dollars, by opening up the opportunity to focus on the COVID-19 crisis, that they can cite facilities and they can convert facilities. So we're waiving some of our environmental processes, CEQA, for siting. We are making it easier to bring up these facilities. We're also making sure that the eligible uses for the existing dollars are spread out more comprehensively to meet this moment. But in addition to that, we are deploying an additional $100 million to the cities and counties in real time to meet this crisis head on and to address the needs of our most vulnerable on the streets and the sidewalks. $50 million on top of that for hotel, motel conversions. And here's the thinking. We're running models, and I'll just give you one of those models for the purpose of full transparency. Over the next 8-week period, we have modeled that of the 108,000 unsheltered Californians that are out on the streets, if you had an attack rate of about 56%, you're looking at 60+ thousand individuals that may have COVID-19. That creates a deep point of anxiety for the existing population, but moreover for our healthcare delivery system, our capacity to move people in and out of the shelters safely without contacting other people and putting them at risk as well. And so as a consequence of this modeling, as a consequence of putting, I think, a punctuation point on the urgency of now to address this issue, we have put these dollars out, but we're also putting out over 1,300 trailers. Now, we just procured those trailers today. We're distributing those trailers throughout the state of California, 1,309 to be exact. We'll be distributing, hauling those trailers, installing those trailers throughout the state of California over the next number of days. And then we'll be turning the operations over to the regions, what we call these COCs and these localized resource centers, so that they could provide that quality bottom-up service that is needed at the moment. But again, we're not just providing the trailers. We now have these additional resources and in the protocols of isolating people that may be COVID positive and may be showing symptoms. The whole idea of the hotel motel contributions, that $50 million, is about bringing people inside with a door, a key, and a lock, with as much supportive service as we can provide under the circumstances. So that's an additional executive order that lays out more prescriptively our approach to address this homeless crisis more aggressively. And I should note that we have 950. Yesterday was 901. Now we're in the process of having identified and surveyed 950 properties that we're working with local municipalities and our state agencies to procure in real time, in addition to the trailers, in addition to the existing infrastructure within the cities and counties that we're going to enhance and support with these additional emergency dollars. So I hope you get a sense the seriousness we're taking the issue of homelessness and the unhoused and those that are struggling the most, many self-medicating, many with comorbidities, many issues that need to be addressed and are most vulnerable under these deep circumstances. We also are laying out additional strategies and plans on surge, more generally defined. There's been a lot of focus in the last few days on our capacity to meet not only this moment, but the moments to come. It's fair to say that if we're looking at a 56% rate of the virus attacking those out on the streets and sidewalks, if you model similar rates in the general population, if you assume for every individual that's contacted or contracted the virus that they impact, let's just say 2 individuals, and we have hospitalization rates as high as, in some instances we model, 20%, that would require a broader surge capacity of our healthcare delivery system, north of 19,500 additional beds. So I know those were a lot of numbers, but let me now try to unpack that. We're running scenario plans, again, for the purpose of full transparency. And that's just one scenario plan. There's others that are more modest, some that may, in some cases, be more extreme. But when you're looking at getting an additional 19,000 to 20,000 beds in your system, you have to look at your existing surge capacity within the healthcare delivery system, and you have to look at procuring additional assets, not just for the homeless, but for the general population. So I want to just briefly give you a sense of what that looks like. This Friday, we will announce the 2 large hospitals that we have procured that we'll be bringing into our portfolio to address that 19,000 to 20,000 gap. We have one in Southern California, one in Northern California. We're negotiating with many other hospitals to bring them online. Local governments are doing the same. But we recognize we need support of the federal government. It was announced last night, I announced that we are requesting specific asks of the federal administration. We would like to procure, and we've been in conversations going back now a few weeks since the Grand Princess was the crisis that focused most of our attention, at looking at our mobile hospital and the prospect of bringing the U.S. Navy to bear and supporting the acquisition of the Mercy here off the coast of the state of California, which would provide an additional 1,000 bed capacity, provides support for pharmacists and other diagnostic equipment. So we put in that formal request of the administration. I referenced last night a conversation with the President yesterday evening specific to that request. We've now more formalized that request today. In addition to that, we have requested 2 mobile field hospitals for the state of California. Those mobile hospitals have the capacity for 496 beds in each of those mobile units. In addition to that, and I'll go into this more specifically in the coming days, have requested a series of other assets, be it PPE, as well as additional support through Health and Human Services, so that we can scale up not just the physical capacity of our healthcare delivery system, but the human capacity that we anticipate. We also have the surge capacity within the existing hospital system that we estimate today is roughly about 10,000 beds. So you add the 10,000 beds within the existing system and the procurement within the state of new hospitals, these hotel motels that are not only for the homeless, but potentially to broaden our capacity to absorb the needs of patients all up and down the state. Working with assisted living, skilled nursing facilities, we're looking at a whole regional approach and a very comprehensive approach to procuring all of those assets. You start stacking them with the federal support through these mobile hospitals and the possibility of getting that Mercy off the California coast. By the way, Mercy cannot come up within a day or two. We're told at least 5 days to get the Mercy operationalized, and then you actually have to move that ship. So one should not overpromise either on the East Coast or the West Coast how quickly you can get those hospitals up, those floating hospitals. But again, we are looking to the federal government to help us with advancing of those resources. So that's a little preview of what we're doing to prepare for the next 8 weeks as we see these cases increase. And just to that point, we're at 598 positive cases in the state of California. As of last night, it's a 21% increase over the previous day. But it's important to note the 12,600 people we've tested so far in the state of California, 12,600, that we have 3,215 tests that have not yet come back, meaning we've tested people, we just don't know the status of their tests. And I make that point to make this point. When it comes to testing, sometimes it can be misleading to say we tested people, but we just simply don't know the results. So they're not reflected in the total number of negatives and or positives. So there's a lag. Some tests come back within a day or two, some most 3, some 4, 5 days. Some hospitals are saying as much as 6 days to get some of their tests back. But we are seeing an increase in our capacity to test. It's reflected in that 12,600 number. But again, we've got to see the turnaround on those tests move. And that's an issue of those reagents we've been talking about, those chemicals, but increasingly swabs. And it is critical. And we've made it crystal clear to the federal government that we need to procure more swabs so we can do specimen samples, not just the diagnostics on the back end. We've been saying this now for weeks, that these kits are not necessarily all complete. And again, for the purposes of clarification to the public, I think we need to be more transparent about that. But nonetheless, our capacity is increasing, but supplies can become increasingly challenging. Just on that, and I'll close, just to be candid about supplies, we also have requested a massive amount of supplies from our federal partners. We are very pleased that the federal administration is now utilizing FEMA in a much more comprehensive manner. FEMA is very familiar to Californians, and a lot of the individuals at FEMA are very familiar with our team, and that's a very good thing, and that's the approach and the mindset we're taking in terms of enhancing our collaboration. We made very detailed asks of FEMA on things from things that have become common in terms of people's expectation of requests on the ventilators and equipment related to testing, but moreover on basic things like glasses and masks, gowns for our frontline employees and our medical professionals. And let me underscore why that's so important. We met with the hospitals last night, and we had a follow-up conversation today. Many of these hospitals are running low on supplies. It depends where you are regionally. And we certainly are going to need more support, and we're trying to pull in that support everywhere we can. We're seeing price gouging. There was an example of 3-cent masks that were on the market a week ago for 3 cents, selling for 83 cents. I want to thank the San Diego District Attorney for going after those suppliers that were price gouging. We'll continue to be aggressive in that place. But we are also seeing hospitals, and I just want to be candid with people, that are going down, for example, to the LA Garment District and requesting seamstresses to start making masks. We clearly have to meet this moment where we're not asking seamstresses in a garment district to make masks. And so FEMA and that request is incredibly important. I heard one case, don't over panic on this, but this gives you a sense where they were purchasing swim goggles because they're concerned about face protection and glass protection. Others that were just going out and getting gloves from traditional hardware stores and from grocery stores. That's not acceptable under these circumstances. And so we're in real time repositioning and reprocuring or procuring and reconstituting our approach to how we address the supply chains as well. But again, FEMA is going to be critical in this respect as well. So all that may sound a little more maudlin than how one receives it, but I just am being straight with people of where we are. But we have a remarkable hospital system, a capacity to get close to 88,000 and 90,000 beds up and running, a surge capacity, 10,000 I talked about. And over the course of the next 8 weeks, we're putting all these plans into play, and we're organizing and distributing those assets throughout the state, not just on the coast, but beginning to more aggressively procure assets and mobile operations in the central part of our state and the deep northern part of California as well. In closing, I just want to thank all of our frontline employees. And I say frontline employees, and that means the pharmacists. That means the folks cleaning the pharmacies. That means the folks in the grocery stores bagging our food that are still showing up at work. All those essential employees that are willing to meet this moment. And of course, our police and fire, our sheriffs, the incredible work being done at the local level, our National Guard, and many others that are really doing an extraordinary amount of work at the moment. And in broadening that, also our state employees that have new guidelines on telework and are doing new rotated shifts and are doing something else that I'm really inspired by. We're doing surveys of our employees in certain capacities of government that are non-essential. Rather than just sending those employees home, they're willing through these surveys to say, you know what, I have this skill on applications that I can apply, and we're shifting them over, for example, to begin the process of helping us with unemployment insurance. Just a simple proof point. We average about 2,000 unemployment insurance claims a day. We have in the past. 2 days ago or 3 days, we saw about 40,000 applications. After that, 70,000. Yesterday, 80,000 unemployment applications, doubled in a 48-hour period. And so in order to meet that moment, I just want to applaud our frontline employees, our workers in these jobs that may be considered non-essential, making themselves essential and rotating out of their job descriptions and new job descriptions to meet this moment. It's just, again, a point of inspiration and deep respect at this moment in time. And it's just part and parcel of what you've come to expect, we've all come to expect in order for all of us to row in the same direction and meet this moment. So that's broad strokes updates. And I know we have number of questions already coming online, and happy to take those questions.
First question. Ashley from Irvine wants to know, are we on statewide lockdown or shelter in place yet?
No, we're not on a statewide lockdown. Again, we had many counties that have come up with home isolation guidelines. Bay Area, Northern California, and now expanding into other counties have advanced those protocols. Lockdowns that still allow essential activities to occur. And that's why you still see people on the streets and sidewalks making their way to the grocery stores, the pharmacies, making their way to work. And they've defined, these county health directors have defined what's essential and non-essential, and have been very clear about that. And I know it's confusing to some because not every county has those same guidelines. But I expect over the course of the next days and weeks to potentially see other counties, just as we saw last night, a number of counties. You'll see additional counties model similar strategies, but the statewide directive is simply this, that all the bars and restaurants are just doing, bars are closed, but restaurants are just doing takeout and pickup, that public gatherings are eliminated with friends or family that are in your social cohort. That does not constitute a gathering, but when it's a mixed cohort, those gatherings we've asked be eliminated, no movie theaters for the moment. Those things are the guidelines that are statewide.
Many people are asking, how are you helping small businesses during this time?
Well, we yesterday announced, and we're very proud and we're grateful to the federal administration, Trump administration. We were the first state to request these SBA waivers so we can start drawing down up to $2 million small business loans with a 3.75% interest rate, pay back as high as 30 years or as long as 30 years, 2.75 for nonprofits. We want to make sure that gets socialized out in the business community, that that exists and that is made available in the state of California for businesses with up to 500 employees. And one of the areas where we have helped or hope to advance sort of an aggregation of a lot of this information is covid19.ca.gov. covid19.ca.gov. It's a new website we put up today. Now, the primary focus of the website is disability insurance payments, paid family leave information, unemployment insurance information, but it will also be adding a link. It's not up on the SBA yet, but we'll be adding a link tomorrow on SBA, and every day we'll be adding more and more services that are more dynamic and we think more relevant to your life.
Last question. Brandy wants to know, how many tests are we doing and where?
Well, we've done 12,600 tests in the state of California. We've got these mobile tests that are out. We announced a few days ago that partnership with Verily. That operation is now beginning to scale. They're looking to go from the 2 counties they've been operating in the last 48 hours to 3. And then we're talking about potentially getting up to Sacramento, Riverside, potentially other communities to, again, broaden those mobile field sites. But Verily's site has a wonderful Q&A that determines people's eligibility. It can calm a lot of nerves as it relates to symptoms, and we do an analysis and a score to prioritize people for those tests. But it calms nerves by telling you what things are and what things are not. And it's a wonderful platform that we hope to scale all across the state, in addition to the 21 labs that are currently doing testing in the state, and then the private commercial labs, not just Quest, but LabCorp, that are part of our portfolio that are substantially increasing the throughput of their capacity of testing, plus the hospitals within our system, not the labs, but the hospitals, which there are 4 on the way to 7 in the next few days that will be conducting tests. The only thing that will be an impediment on tests are continuing to encourage people to get out of the hospital system to get tested, more mobile sites, but the only impediment again there is specimen sampling, getting these swabs, and continuing to address some of the other ingredients, these reagents, RNA extraction kits, and those other confusing things that are part of the ingredients of the testing. And that's why, again, we're looking to procure those directly through the manufacturers, working with the federal government. I know of one flight just coming back from China with a lot of those supplies as one example. It's a big logistics operation, and that's what we do best. So that's it for tonight with the updates. A lot more coming tomorrow. I'm just proud of state employees, proud of all those first line employees, broadly defined, but none more heroic than our nurses and doctors, the medical professionals, and the support staff. Don't forget the support staff behind them. And let me just say one final shout out to the janitorial staffs. I've been seeing them just around here doing heroic work, keeping things sanitary, keeping things clean, showing up at work. Hats off to them, and hats off to all of you. California strong. Thank you.